Have you heard about the United Healthcare CEO? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got Tina Nunziato sitting right here by my side. If you're watching us on YouTube, thank you for joining us. If you're a first-time listener, we welcome you. And if you're one of our regular listeners, we are so appreciative that you are on this journey with us and that you continue to take some time out of your busy schedule to hang out with us for 15-20 minutes and listen to us. All right, so some
crazy news.
Crazy headline news from this past week. Some of you may have heard of it. Some of you maybe not. In case you haven't, the CEO of United Healthcare insurance company was shot to death this week in broad daylight as he was getting ready to walk into a meeting in downtown New York?
Yeah, in Manhattan.
Manhattan.
Yeah, he was going to an investor meeting and was shot.
Yes, and he'd been CEO for quite a while, I think.
Well, he'd been with United Healthcare since 2000, and he had joined United Healthcare in 2004. He was made CEO in 2021.
I mean, a pretty young guy, just like in his mid-50s.
You know, he was 50.
Oh,
he was
50?
my age. Yeah.
My goodness.
He was born my
very
month,
young.
Too. July of 1974. So he just turned 50 years old.
Very young. Yeah, that's very sad.
Yeah.
Very sad. But a lot of has definitely pulled the lid off of a lot of cans of all kinds of stuff.
Oh my goodness. And the reason why we wanted a podcast on this is that even our teenagers are talking about this, which is crazy to me. I mean, this thing has just gone viral. And if you haven't heard, I'm surprised if you haven't heard about it because it's everywhere right now.
It is everywhere.
And
it's not surprising that our kids know about it because everything is on social media. And these kids are like inundated in their TikToks and Snapchats and whatever they're on. And but yes, pretty crazy. Apparently, a very intentional shooting. Okay, that had been premeditated. From what you were telling me the other day, they were able to track down a Starbucks cup. I guess this person had been at Starbucks earlier that morning and had bought something to eat and a Starbucks, drink.
Coffee and water.
And so they were able to trace him back, just because of cameras that are out on the streets. And we're able to, I guess, get the cup that has his...
a partial fingerprint. They still have not found the killer at this point. He's still at large. And the crazy thing is, again, it's not like anyone condones murder.
No.
But there are people who are like, we get it. Like this, and I've told you, like, I feel like this industry, the medical industry, medical insurance, the situation with what's happening with medical insurance today, it's getting really bad. Like it is getting very burdensome for so many people, not just like for patients, but for doctors as well. Our office as well has experienced this. And I don't think patients realize like what doctors have to deal with as well with the insurance companies, but it's getting really bad to the point where I told you, like, something's got to give.
Right.
And then this happens, right? And what's crazy is that immediately every other healthcare insurance company, even like a CVS, they went online, they took down all the names and pictures of all their executives because everyone's worried now that everyone's going to be a target.
Sure.
The top security companies in the U.S. are being bombarded, with phone calls for security detail now for CEOs and executives. And it's really sad because, these industries are making a lot of money off of the backs of doctors and patients right now. And
did you take our pictures off our website?
No, I did not.
But actually, our son told Tina just earlier today when they were talking about it that even places like Subway, just stuff like they've recently increased their prices for like the foot-long subway, and now they're like bringing it back down because they don't want to get shot.
They're worried that somebody's going to get shot.
People are angry. People are so angry these days, and so yes, we have struggled so much through the years, and because of the health insurance companies, okay? Because, we, in our field, we don't get paid right away when we provide a service. We get paid, 30 to 60 days after we have provided the service. So I do a colonoscopy. Unless you're a cash pay patient who's paying up front, but the majority of patients have insurance. But when I do that colonoscopy, it's not like I'm getting paid right away. Then there's an entire process of, where that claim has to be submitted, and I don't always get paid.
That's right. And actually there's work that leads up to you even seeing the patient and doing a procedure, getting the prior auth, and then we get denials. And so the other thing that was found at the scene of this was the casings of the bullets that were used to kill this guy. His name is Brian Thompson. Had the words delay, deny, defend. Okay. And apparently this was a book that was written in 2020 by a gentleman named Jay Feynman, who was basically shedding light on what's happening in the insurance industry today, which is what we experience every day in healthcare as providers. Right. The idea of delaying getting the prior auth, delaying everything, then denying the claim, and then defending their stance on these things. And now, since the birth of AI, a lot of these companies, especially United Healthcare, are using AI algorithms to deny people to have their claims paid. And it's getting to be a huge burden in this country. And so, even Brian Thompson, United Healthcare, they're actually defendants right now, currently, in numerous lawsuits going on with the government, Department of Justice. Since, for example, United Healthcare, I think back in 2020, 2021, they did the acquisition of Change Healthcare. Okay, now we were also affected by this year, the Change Healthcare thing, because Change Healthcare is, it's an intermediary between providers and payers. Okay, so every transaction that we do has to go through what's called a clearinghouse, right? And Change Healthcare is a clearinghouse. So every claim we'd submit, whether it was United Healthcare, Aetna, Banner, whatever, had to go through Change Healthcare. Now, United Healthcare acquired Change Healthcare a few years ago. Now, this was a big deal because this meant now that United Healthcare has basically access to the whole revenue chain. And when they first said they were going to acquire Change Healthcare, the government kind of made a stink and said, you really shouldn't own a company like this because you're going to own the whole revenue cycle. And United Healthcare fought it, and United Healthcare won, okay? And they were able to acquire Change Healthcare, but they made a big deal about how, our different silos within United Healthcare can't access what Change Healthcare has, which is probably a lie, and that the government was going after them, since then about this. And when the Department of Justice started filing lawsuits, the kind of higher ups, like one of them being Brian Thompson, he went and sold a bunch of his shares, $15 million worth of shares. This is a guy that already makes about $10 million a year in salary, okay? United Healthcare alone is worth $505 billion. Okay, let me just say that again. $505 billion, okay? Their stock was selling for over $600 a share before this happened on Wednesday. It's down to $550 a share, which is still high. Yeah. Okay, when you compare it to like Apple. Apple's at $242 a share. Microsoft is at only $443 a share. Cigna, $317 a share. And Amazon's at $227 a share. And then you've got this behemoth of United Healthcare at $550 a share. These companies, these insurance companies, are making money from patients. They're not paying doctors, and they're getting money from the government. Another lawsuit that they had was through Medicare Advantage. United Healthcare has a huge Medicare Advantage group, which is Medicare Advantage taking care of seniors. They're getting money from the government to take care of these seniors that are never going to the doctor. Okay? So again, these companies are making so much money and they're not paying the providers to do the work. It's very, very frustrating. One of the things that patients have been talking about is, was the guy that did the shooting, was it his wife or his child that got denied coverage? Because that could lead you to do something so drastic, right? Yeah. It's sad, but this is happening to millions of people nationwide, and it's happening to us as providers. So like for us, we've noticed in the last few years that we cannot, even as a provider, we cannot get a hold of anyone at United Healthcare. We cannot get a hold of a live person anymore. Everything is done through their portal. You can't even talk to anybody anymore, which is very, very frustrating. The other thing that's happened is that they have gone and analyzed every provider, Dr. Cruz being one of them. And what they've done is, because Dr. Cruz is so thorough in her exams, that means she costs United Healthcare more money because she does more biopsies, because she wants to make sure she's, when she does a colonoscopy, she's covering the whole colon, right? Well, because of that, she costs United Healthcare more money. So they put her as a tier 2 provider. She's not considered a tier 1 provider. So they're making up rules to pay her less money and to tell patients, oh, Dr. Cruz is a tier 2 provider, you shouldn't go see her, okay? This is where monopolies in business come in. This is how monopolies form. And this is how frustrating it is for patients and providers to work in a system that all Dr. Cruz wants to do is take care of people, okay? And this is the situation we're dealing with. And it's not just United Healthcare. This is all the insurance companies, you guys. This is really sad what's happened in this business of medicine. And I think this was just like, this happening last week was like, I think the straw that broke the camel's back. And there's been a lot of articles of people who their spouses or children have died in the past because of something that's happened with the insurance companies, and it's just brought back, this whole thing last week has just brought back all of this pain and suffering of these people. And everyone is like saying it's time for a change, so it's going to be really interesting to see what happens. It will be, because these are big companies. Yeah. And, they've got the government wrapped around their little finger. Absolutely. So it will be interesting to see if, right now there's a lot of excitement out there because it just happened, but once the dust settles, what is going to happen? Will it change? We could only hope that there would be some changes. And look, when you have to hire a team in your office just to focus on getting authorizations for medicines that have been out there for decades, okay, that should be easy to get approved for our patients. But no, instead, we have to have a whole team who all they do is just make these calls to get these prior authorizations. A team that all they do is get authorizations for procedures, and and then half of the time our providers spend, well, not half the time, but a lot of time trying then to justify why we're doing a procedure. Okay, we get a denial. Now we have to do a peer-to-peer. That takes time. All those phone calls, and all we're trying to do is just take care of the patient. That's right. And then we bill it, and it gets denied again, and now our billers have to spend all this time filling out paperwork just to get paid. So all this work, from the teams that have to be on the phone, getting the prior auth, to all the peer-to-peer work that the providers have to do, to then all the work we have to do, the billers, to get paid maybe $180 for a colonoscopy. Yeah. Okay? So half of the work that happens in our practice is all related to the insurance companies, getting authorizations, doing these phone calls to try to get an authorization for a procedure, for a medicine, trying to justify, why we need an ultrasound, okay? As opposed to being able to just focus on providing care. They make it very difficult, very difficult. And this has been going on for... Yeah, it's just getting worse. Yeah. It's just getting worse. The amount of denials is going up. like you said, with the medicines,
Right.
even now, like, to justify putting a patient even on a PPI medicine, that technically they can go buy over the counter, right?
Like a Prilosec.
Right, but we want to give it to them in a higher dose, for example. We have to submit proof that they've taken these other 4 medicines, and the amount of paperwork and the amount of effort that goes into just justifying getting them a medicine is just over the top ridiculous these days.
Yeah.
So it's going to have to give.
Yeah.
At some point.
Yeah.
And it's going to be really interesting to see what happens as this falls out. Our teenagers are so funny because they're like, no one's going to go look for this guy. This guy that did the shooting, he's going to totally get away with this because no one wants him to be caught, And it's just like, oh my goodness, it's crazy how this has affected the world, or at least our country right now, and what people are talking about. But anyway, if you haven't heard about it, look into it. Know what's going on, understand what's going on at both the patient level and the doctor level. So, maybe you don't get so mad at your doctors next time. You can't get a medicine, or, you didn't get approved for a test. It's not on the doctors. We're trying our hardest. Just keep that in mind.
Yeah, absolutely. Well, if you would like to connect with us, you can find us on our website, drlizcruz.com. There's a magenta colored button on the website that you can click, and you can schedule a free 30-minute wellness consult. That's free, and that's done over the phone, so you could do it from anywhere. If you haven't rated us, please rate us, and please give us a 5. It'll help other people just like you to find us faster. And lastly, if you have not subscribed to our podcast, please subscribe so that you never miss an episode. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.